Hi, this is Dee, and you're listening to my podcast, Let Me Clear My Throat. Today's episode, I'm going to talk about something that I would like to say that everybody probably experiences. Maybe some, maybe more so than others, or maybe some people don't realize it, or I don't know, maybe think that they are, I hate to use the term, but crazy, because I believe we all got a little craziness in us. I always say that crazy is the new normal, and what do normal people do? But this episode, I'm going to talk about hallucinations, and I got this from a website. Off the top of my head, I can't think of what the name of the website was. I think it was Recovery Ranger. I think I'm not sure, but anyway, usually I have this stuff written down here. But unfortunately, I forgot to write it down on my paper. But it was medically reviewed. I'm going to probably butcher this person's name. I seem to be pretty good at that. Zilpah, Zilpah. And the last name is, I know I'm going to butcher this one, Sheikh, Sheikh. He's a medical doctor. And it was written by Kendall K. Morgan on 4/6/24. Anyway, I have not really read this. I've kind of skimmed it a little bit, but I wanted to kind of go over this with you, and I'm not really for sure on how long it's going to take to read through it, but I thought it had a lot of nice, interesting key points in it, if you will, that kind of put a lot of things in perspective for me, but I'm hoping that maybe it might put some things into perspective for you as well. So, excuse me. My throat is saying I don't want to talk. So anyway, we're going to talk about hallucinations, and I'm going to go ahead and get started because I have a lot to go over. So it says sometimes a hallucination means you'll see something that isn't there, but hallucinations can affect any of your senses. Hallucinations are false perceptions where you sense an object, a person, or an event, even though it is not really there or didn't happen. It seems very real to you. Sometimes you may know you're having an hallucination, and other times you may not be too sure. If you're like most folks, you probably think hallucinations always have to do with seeing things that aren't really there. But there's a lot more to it. It could mean you touch or even smell something that doesn't exist. Hallucinations can involve any one or all of your senses: sight, sound, smell, touch, and taste. There are many possible causes. Generally, they happen from chemical reactions in your body or changes in your brain. It could be a mental illness, called schizophrenia, a nervous system problem, such as Parkinson's disease or epilepsy, or several other things. If you or your loved one has hallucinations and you don't know why, you should speak to your doctor, obviously. You can get treatments to control them, but a lot depends on what's behind the trouble and what the issue is and what's causing your hallucinations. I know, and well, this is actually in here as well, but my mom is blind, and she has Charles Bonnet syndrome, which is basically when you're blind and your brain has nothing to do. Basically, your eyes don't have anything to do. So your brain makes up things for you. And sometimes she will see things that are not there. Like, for instance, one time she said that she saw an elephant in the living room. And she knew the elephant wasn't there. And then another time she saw some construction workers in the yard. She said she didn't mind that hallucination. And she's had a few other ones and stuff, but that's just an example of some things. And also, too, sometimes your medication can also have an effect on you. So it's not always just a certain disease per se or mental illness. Sometimes it can totally just be your medication or maybe an underlying condition that you don't know you have. It says hallucinations versus delusions. A delusion is a false belief. You may think something is real when it isn't. But a delusion doesn't involve sensory experience or something that isn't real. So it doesn't involve a sensory experience per se of something that isn't real. Hallucinations versus paranoia. Paranoia is a certain type of a delusion. You will think other people are out to get you, even though they aren't. You may feel without reason that others are being mean, unfair, or dishonest with you. Now, sometimes I know from past experience that some people may actually have some things going on where people are doing stuff to you. They are following you. They are stalking you. They are harassing you. I mean, you hear lots of times of people, obviously get come up missing, or they get killed, or things like that. And I know, like, for a fact, quite a few years back, probably back in, I think it was 06 or 07. No, it had to be in 06. I had a person that was stalking me, and everywhere that I was, he happened to be. And I didn't live in the city. And one Saturday morning, it was about 6 o'clock in the morning, and I happened to still be in the city at that time. And I was going to the gas station, and I was going to go in and get me something to drink. And I never had went to this gas station. Like I said, I didn't live over there, but I had went to karaoke the night before, and I was heading home. And I went to the gas station, I got something to drink, and I came back outside. And sitting in his truck right there in front of the door was my ex that was stalking me. And I'm like, out of all the places, why would you be sitting outside here when I went inside to get something to drink? And that's just like one example, but it got really, really difficult with him. And some other things had happened. Obviously, I've talked about being raped and stuff. And he was the gentleman that basically I woke up in his basement and I didn't know how I got there. And I went and got a no contact order on him. And I was getting writer's cramp from all the things I was writing down for the judge. And the lady told me, she's like, he basically approved it like that day. And the lady's like, I've never seen him just to sign off of it without going to court. And she said, but whatever you put in there worked for him. And he immediately signed it. He didn't even set up a court date, nothing. And so I had a no contact order against this guy for like 2.5 years. And it got to the point where I changed my number and stuff. And so he started calling my son's number. And he would show up at my house. Or I went down to my mom's house one time, and there was no vehicles in the drive at all. And I was inside the house. And for some reason, he come knocking on the door. And like he knew I was there. And I didn't live there at all. And what had happened was his route from work came out in my area where I lived. So he just took it upon himself to try to track me down. But there was just a lot of stuff. But a lot of people would think, if I said, hey, somebody's following me, somebody's stalking me, and they just think, oh, you must, be mistaken, or you must be on something, or, you're imagining it, or whatever. And a lot of times, they don't want to believe you because that seems so far-fetched. But unfortunately, that is a reality for a lot of people. But there are also incidences where that isn't the case, and it is a paranoia. And it might just be from something that they've experienced, or it might be something that's went on in their life, or it could be for a number of reasons. So there's a lot of different things there. But I guess my point is, don't be so quick. Actually, you shouldn't be at all. Don't be so judgmental. Because, like I knew this friend of mine that was suffering with some stuff, and I said to him, it might not be real to me, but if it's real to you, then it's real to me. Because whatever it is, obviously it's real to you. And just because I might not see or hear something that you do, doesn't mean that it's not real, because it's real to you. And it's not always about my perception when somebody else takes it a different way. So, it's sometimes it's just a matter of trying to be understanding and empathetic on things that you personally have not experienced or don't understand. Because sometimes that can make the difference on what somebody else is going through, make them feel like they're not losing their minds per se, and that somebody actually believes and can validate, listening to them and hearing them out, and maybe try to troubleshoot what's going on. And very well possible, it might be just that, or it might be an understanding, or whatever the case may be. But if people are too inclined to want to be so judgmental, then that person that is going through it is just left hanging. And sometimes it can make it more harm than good. It could actually hinder it more than help it. So just my opinion there. Hallucinations versus illusions. An illusion happens when you misunderstand or misinterpret something that is real, or that has actually happened. You might think that a black object is a cat when it isn't. An illusion is based on sensory inputs in the world. In hallucinations, you'll experience sensory inputs even though there's nothing there. So I don't know if people have done this, but I have, obviously. When you're like doing something and you look over, and my eyes are not the greatest, and I know I need to wear my glasses, but sometimes you might think that you make something out, and then you get up on it and it's like, that's totally not what it was. And sometimes it's your eyes are playing tricks on you, but also too, it's a matter of focusing on what you see, because some things just are distorted. And if you're like me, your imagination goes wild. And then you create sometimes whatever pops into your mind. It might be a first impression or something. And then if you actually look at it too long, it could actually look like it moves, or something, because your left hemisphere in your brain controls your hallucinations, basically. And if you look at something too long, sometimes it can look like it moves, when in fact it's not. And that's not always the case on everything, but that is a factor. So if you've got, so maybe like you got a head cold, or, excuse me, you've, got swelling or something, and there's some pressure on your left hemisphere, that might also cause some issues as well. So anytime you got something like that going on, or anything for that matter, you really should talk to somebody, because it could be an underlying condition, and that does not mean that you're, crazy. But by all means, talk to somebody, talk to your doctor, or somebody that you trust, and try to seek at least some medical attention or something to try to help you alleviate if there's some type of underlying condition that, like I said, you might not even know. Or they might need to adjust your medications. Or like me, you probably need your eyes checked and put your glasses on. Common causes of hallucinations. Hallucinations can have many different causes. They may be temporary or ongoing. They may be caused by a mental health or neurological condition that affects your brain. Drugs, including medications and medicines, also can cause them. Hallucinations most often result from schizophrenia. More than 70% of people with this illness get visual hallucinations, and 60 to 90% hear voices. But some may also smell and taste things that aren't even there. Parkinson's disease. Up to half of people who have had this condition sometimes see things that aren't there. Alzheimer's disease and other forms of dementia, like Lewy body dementia, they cause changes in the brain that can bring on hallucinations. It may be more likely to happen when your disease is advanced. So obviously those are medical conditions that one might think is making them crazy, when in fact it's an underlying condition. Migraines. About a third of people with this kind of headache also feel an aura, a type of visual hallucination. It can look like a multicolored crescent of light. Now, I get migraines. I am on, 3 medications for migraines. I take one in the morning, one at night, and then I have one that dissolves in my mouth for emergency, for like when they come on set. So I know all too well how migraines go. And I know that like your eyes are really sensitive. You can't really focus. Light is a no-no, and many, different things. So that kind of can go a lot with your headache, because there's obviously some electrical currents, and however you want to word it, that's going on there that is causing pressure on your head in certain places that cause the reaction of your, your migraines. Brain tumor. Depending on where it is, it can cause different types of hallucinations. If it is in an area that has to do with vision, you may see things that aren't real. You might also see spots or shapes of light. Tumors in some parts of the brain can also cause hallucinations and of smell and taste. Charles Bonnet syndrome. This condition causes people with vision problems, such as macular degeneration, glaucoma, and cataracts to see things. At first, you may not realize it's a hallucination, but eventually you figure out that what you are seeing isn't real. Epilepsy. The seizures that go along with this disorder can make you more likely to have hallucinations. This type you get depends on which part of your brain the seizure affects. I know, like with my son, he was having seizures real bad from a concussion from a football injury when he was in high school. And people in class, my son's kind of like a character. People in classes took it as he was joking around, playing around. But he had actually dived underneath the table and chairs in the classroom and was hollering media shower and something else he saw. I don't remember what it was. And they thought he was playing around joking. He was actually hallucinating. And he started having seizures, and they put him on medication, and his seizures got worse. He was having like 6 to 8 seizures a day, and from November to February. And he went on an IEP because he was struggling really bad. And my son had never missed a day of school since 2nd grade. And so he was determined to go to school because he didn't want to miss school. And they ended up putting him on a leave and shortened his day. He only went part-time, and then that got too difficult because I was going in and picking him up in the afternoon, or he was going in late. And it actually messed with the left side of his body. And he would have trouble walking. Sometimes he would drag his leg along, or he'd get numb and paralysis a little bit. I had to reteach him how to tie his shoe, 2 plus 2, the simple things. He would have a seizure, and he would throw my youngest daughter's baby shoes at my door to get my attention. Or when we went somewhere, he had to sit in the front seat, and he always hallucinated. He was really big into wrestling, so I don't know if it had to do something like that. But the character he described was kind of like the Undertaker. And he would just like the guy would come through the van or something. And one time he was having a rough night, and I was sitting down next to him talking to him, and he was just looking at the ceiling fan, just taking his head and spinning with the ceiling fan. And I'm like, what are you doing? And he was like, you don't see it? And I was like, see what? He goes, that lady hanging on the ceiling fan, her skin and her clothes are just hanging off of her body. And he's just like spinning with it. And I was like, well, stop looking at her. And then he was like, Mom, be very still. That guy's right beside you. And I said, well, that guy needs to leave me alone because I'm trying to talk to you. And, but it was something that he was going through. And then come to find out it was because of his medication was increasing and having effect on him, to where instead it was helping him with his seizures, it was actually intensifying them. And come to find out that he was taking a very high dose of his medication. And they had done brain mapping on him, and all that stuff with the electrodes and stuff to his head and all that stuff. And he had pseudo seizures and partial seizures, and this has been a long time, paralysis of his left hemisphere. So it was causing problems with him. And the paralysis and stuff was causing problems with him hallucinating and stuff. So obviously, seizures are, they're nothing to play with. I mean, they're really not. He was homeschooled. He started going to the library on Tuesdays and Thursdays to get his schoolwork and stuff done. And then he ended up, once they took him off his medication, he actually got better. He had one more seizure, and then from this day, as far as I know, he hasn't had one since. And he wanted to be, his choice, he wanted to be seizure-free for a whole year, before he drove, because he was getting his driver's license. And he did not want to drive for a full year because he wanted to make sure he didn't have any more seizures. He didn't want to be driving and have a seizure and hurt himself or somebody else. So he chose not to drive for a full year. And he ended up then going back to school, and they had another meeting to take him off of his IEP, and he actually graduated early. So that's just an example on how things can affect you, that some people may think that it's one certain underlying thing, a mental illness or, whatever, but sometimes it's actually from something as simple as hitting your head playing football, or getting tackled or whatever. Hallucinations and your mental health. Many mental health conditions may involve hallucinations. It's most common to hear voices. Schizophrenia is the main one, but other conditions fall under the spectrum of schizophrenia, including, now I'm going to butcher this word, I know I am, no, maybe I'm not, schizotypical personality disorder, SCHIZOT as in Tom, YP as in Paul, AL, personality disorders, delusional disorder, brief psychotic disorder, schizophreniform disorder, and schizoaffective disorder. Other mental health conditions that may involve hallucinations are bipolar disorder, major depression with psychotic features or psychotic depression, postpartum psychosis, and PTSD. And I've got 3 of those: bipolar, major depression, and PTSD. Drug hallucinations. Many medicines your doctors may prescribe can cause hallucinations or make hallucinations worse. Some recreational drugs can also cause hallucinations. Hallucinations from medicine are more likely as you get older. The hallucinations may be related to the amount of medicine you're taking. Usually you'll stop having them if you lower the dose or stop taking the medicine. You should never stop taking your medicine, though, without talking to your doctor first, because you can have withdrawals and they could have adverse effects and stuff. And obviously you want to make sure that whatever medication you're taking is compatible with some of the things you're eating and drinking. Because I know, like, for instance, grapefruit and grapefruit juice are not compatible with majority of medications that I know of. And it can actually have a very adverse effect on you. So you definitely want to make sure that you check all the ins and outs of different things. You might like grapefruit and whatever and not think nothing of it, and then take your medicine. You might drink some grapefruit juice with it or something, and it might have a counteraction with your medicine or something more dangerous. So definitely want to make sure that you check into something like that. Hallucinations and sleep. Hallucinations can happen just before you fall asleep or right after you wake up. They may get better if you get more sleep or sleep at regular times. Avoiding alcohol or other drugs may help too. If you're having hallucinations relating to sleep, and especially if they're causing you anxiety or trouble sleeping, obviously talk to your doctor. You may need a sleep study. If you're having sleep hallucinations and are severely tired during the day, you may have narcolepsy. And they do obviously have medication for that as well. Hallucinations can also happen during sleep paralysis. This is a condition right after you fall asleep or waking up when you can't move or speak. You may think you hear, see, feel, or sense something while you're unable to really do anything about it. And also, too, sometimes people forget that if you stay up day after day after day, that does something to your mind and your brain, and that also can intensify different things as well with your sensories and hallucinations and whatnot. Other causes for hallucination. Many other conditions or scenarios can make you hallucinate. They may include a high fever, dehydration, especially if it's majorly severe. Trauma, severe pain, grief, infections such as maybe a urinary tract infection. When hallucinations are short-term or caused by a temporary issue, they aren't always too concerning. But if you're hallucinating and you don't know why, or if you're having some kind of medical issue, obviously seek help. There's no shame in seeking help. Better safe than be sorry. Types of hallucinations. They can affect any of your five senses and have several types. So your visual hallucinations, you may see things that aren't there. It could be just about anything. Objects, people, animals, lights, shapes. You might see things that others don't, such as maybe insects, crawling on your hand or your face or someone you know. Objects with the wrong shape. Things that are moving in ways when they usually don't move. Sometimes they look like flashes of light. A rare type of seizure called optical may cause you to see brightly colored spots or shapes. Other causes may include irritation of your visual cortex, which is the part of your brain that helps you see. Damage to the brain tissue, maybe like lesions or something on your brain. Schizoaffective disorder, depression, bipolar, infections like drug use or withdrawal, or body and brain problems, dementia, Parkinson's disease, seizures, migraines, brain lesions or tumors, sleeping problems. Drugs can make you hallucinate. They could be street drugs or medication drugs. Metabolism problems, and I'm going to butcher this name. I used to know how to say this. Creutzfeldt-Jakob disease. I know I butchered that. Creutzfeldt, as in David, T as in Tom. Jacob disease. Auditory hallucinations. My mouth is just not wanting to work today. Auditory hallucinations. You may sense that the sounds are coming from inside or outside your mind. You might hear the voices talking to each other or feel like they are telling you something to do. Some causes may be from schizophrenia, bipolar disorder, psychosis, borderline personality disorder, and post-traumatic stress disorder, PTSD. Might also be from hearing loss. Maybe your hearing is not as good. Sleep disorder, brain lesions, and drug use. Obviously, that's just some of the examples. Tactical hallucinations. You might think that you're being tickled even when no one else is around. Or you may feel like insects are crawling on you under your skin. You may feel a blast of hot air on your face that isn't real. Possible causes could be, schizophrenia, schizoaffective disorder, drugs that may make you hallucinate, alcohol, Alzheimer's, Lewy body dementia, Parkinson's disease. These are just some examples. Olfactory hallucinations. You may think that the odor only you can smell is coming from something around you, or that is coming from your own body. And some causes may include from a head injury, a cold, temporal lobe seizure, inflamed sinuses, brain tumors, and Parkinson's disease. Gustatory hallucinations. You may feel that something you eat or drink tastes strange. A common one is to feel that things taste like metal. Causes can include temporal lobe disease, brain lesions, sinus diseases, epilepsy, presence hallucinations. You will feel as if someone is in the room with you, even when there's nobody there. I'm going to butcher this one too. Proprioceptive hallucinations, easy for me to say. You may sense that your body is moving in ways that it's not. For example, you may feel as though you're flying or floating in midair. um, Hypnopompic. Jeez and Pete. These hallucinations happen right after you wake up. I know I totally butchered that word. It's Hypnopompic. These hallucinations, they happen just before you fall asleep. And they happen most often when you have narcolepsy. So, diagnosis for hallucinations. First, your doctor obviously needs to find out what's causing your hallucinations. And if it's your medication or some underlying factor, they might run a series of testing and stuff to see what's going on. They may adjust your medication. They might ask you, if there's certain changes or stuff that go on. There's a lot of different factors that they can help you with to try to figure out what's going on with you. And I know sometimes some things might mock other symptoms, and where one person might think it's got to be this. Excuse me, it's got to be this, when in fact it's mocking something else. So obviously, thorough testing and communication with your doctor is very vital. And if you start taking a medication or something and it's not, you notice a change. Like if you start noticing something different, or you start getting headaches, or having some adverse reaction, obviously let your doctor know that, so they can either adjust your medication dosage, or they can get you something else that might be more user-friendly for what you need and compatible with other medications you may take. But also to acknowledge and note that things that you take, even over the counter, and even herbs or supplements or vitamins and stuff that they have over the counter, even those can have a reaction against the medications you're taking that are prescribed. And obviously, if you take street drugs and alcohol, they're not compatible. So what you think might be, I'm just taking these vitamins and stuff, might in fact be causing more harm than good to your having a reaction with your medication. And if you have questions, obviously ask your doctor, but also you can talk to the pharmacist. And they're usually very on it if they know what you're taking, like prescription-wise. If they do not act well with each other. I know we had pharmacists actually caught that with my mom one time. Some medication she was taking, it was not user-friendly with another medication. So that was very nice that they caught it. But also, too, if you have questions about over-the-counter medicine, you can always go up to your pharmacist and say, hey, I'm on this type of medication, would this be okay to take it? And, stuff like that. So, I know St. John's wort and stuff is not compatible with some stuff. That's just one example. But obviously, always, ask somebody that is knowledgeable, whether your doctor, the pharmacist, or somebody, and they can help you on that. Better safe, obviously, than very sorry. They'll ask you about your medical history and maybe do a physical exam. They'll talk to you about your symptoms. Like I said, they might be running tests on you. They might do an EEG on you. Like with my son doing seizures, they did a video EEG on him. So he went to the children's hospital. It was the Peyton Manning Children's Hospital. And they hooked him up to a bunch of electrode things to his head. And he basically was in the hospital a couple days, and they had a video machine on him, basically recording him. So when he would have a seizure, it would monitor his brain waves and also video record his reaction physically. And when they did brain mapping on him, I joked with the doctor. I said, "Did you find a brain up there? Is there anything up there?" And of course he laughed. But this was something obviously that they did to him, and this is testing that they obviously needed to do to find out what was going on with the seizures. And sometimes when you have pseudo seizures, that's basically when your body, your mind is basically making you have false seizures. And you don't necessarily even realize that they're pseudo seizures, because to you they feel very, very real. But in fact, they are false seizures, and your brain is making a reaction to where it's making your body think that it's having a seizure. And when in fact it's not. And there are over 30 different types of seizures. And anybody can have a seizure at any given time. Any given time. And we also learned they intentionally put my son into a seizure to monitor him. And the way they did that was with a strobe light. So strobe lights and flashing lights are very dangerous for people that are seizure prone. And I know that when we would go skating for like a birthday party, I had to let them know he can't have any lights on, the strobe lights and stuff. And so they made sure that they kept the strobe lights off for him, and the big bright flashing lights and stuff, because it could set him into a seizure. And I never knew that about the flashing light, but now, looking back on that, it made sense. But they had him in a room and turned on the strobe light and knew that they were going to put him into one, but they wanted to monitor him and set him into one. So that's something else to keep in mind. And they'll check for unusual patterns and stuff for your electrical brain activity and stuff. And it might just be showing that you have hallucinations due to, your seizures and stuff. And it could be a variety of different things. You might get an MRI done, which uses powerful magnets and radio waves to make pictures of the inside of your body. It can find out if the brain has a tumor or something else, such as an area that had a small stroke, could also be the blame. And I know, like with the MRI, it's a magnetic thing, and what it does when you go through the MRI, it imagine like you're, I don't want to say an onion, but like say you're slicing an apple or a tomato or something, and you're slicing it really kind of thin, and you're going through there and you're slicing it. That is what the MRI does to you. It basically slices, not, literally slices you, but it literally does its electronic magnetic radio wave stuff, and it dissects your body basically in slices to look at every single section of you, if you will, to get a reading on different parts of your body. And so that's something else too that could be a big factor too. Or if like you have a stroke or something, they might do something like that on you, or maybe a CAT scan or something. So it could be something simple, although that's complicated. And I don't know if anybody's ever, I know people have been in one. That's kind of a silly thing to say, but I've been in an MRI machine before, and I did not like it. They have the radio on, but you can't hear it when the big electronical noise goes on. And I was ready to get out because my claustrophobic kicked in real bad. And I had to close my eyes, and I was having a moment. And she's talking to me, and I can't hear a word she's saying when the machine's going off. And she's like, well, we got music on. I'm like, I can't hear a single word of it with this loud machine on. So it really didn't do me no good. But so that might be something else too. Hallucination treatments. So treatments that they can give for hallucinations. Your doctor will treat the condition that's causing your hallucinations. This might also include things such as your medication, either from schizophrenia or dementia, Alzheimer's disease, or whatever medication that you're taking that may be having an adverse reaction. But also too, if I know that like on a bunch of medications that I have saw, a lot of the side effects are hallucinations. And so I know in ones that I have read or whatever, that has been a very big common factor. And maybe people just kind of skim the the symptoms or the I can't even think of the word now. I just had that word too, didn't I? Basically, side effects. There we go. You read through there and you can't really, you just might skim the side effects, or maybe you don't even read it at all and you're just like, But it's really important to read through there, because sometimes that also factors in what you need to expect, because sometimes some medicine might make you sleepy, it might make you drowsy at certain times, it might give you insomnia, um, it might give you major headaches or stomach problems, a lot of different things. So knowing what side effects your medication has, you might have multiple medications that have a lot of side effects that are the same. They might favor some other side effects that the other medication does. So knowing, I guess, basically what you could expect for yourself is really important. And I know, like, some of them side effects are death. And I know in one of my other podcasts I talk about this infomercial talking about serious side effects. Contact your doctor if your side effects are like blah, 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 and death. And I'm looking at the TV going, and how am I supposed to contact my doctor if I die? So I don't really know if they thought that through, but unfortunately sometimes some side effects are that. And it's very important to know and cross-reference and look them up, because you might think that the definition of one of your side effects, but knowing the detail of it, because I know some things have multiple definitions. So knowing, I guess, what to expect in your definitions and knowing what you're even reading. And I know some words are pretty big words. And, if you're like me, I'm going to butcher it. And it's like, okay, that's a cool, long, complicated word. But then you're thinking, I have no idea what that meant. So it's always good to look up your medications, the side effects, any potential reactions, what you should watch out for, how you should contact your doctor. And obviously, knowing if there's any type of red flag or concerns with your medication, you definitely want to make sure that you talk to your doctor on that. Very important. Anti-seizure drugs to treat epilepsy, treatment for macular degeneration, glaucoma, or cataracts, surgery or radiation to treat tumors, drugs called triptans, beta blockers, anticoagulants for people with migraines. Oh, I didn't say. I made up my own word. That's the blood thing. Anticonvulsants. Totally not anything like anticoagulants. So anyway, I'm making up my own words, which that is a word. So anyway, moving on. Your doctor may prescribe. It really wouldn't be that complicated if medical terminology was not such big words. I mean, if it's something to say, say for instance, you got a migraine. Why can't it just be like, headache be gone? Or, stop my migraine, please? Or, why can't it be something simple like that? Why does it got to be some kind of big old long word? And then half the time in medical terminology, you have to know your definition backwards. So when you read medical terminology, you read it backwards from the right to the left. And, so it gets very complicated. And, it can actually give you a migraine, but I don't understand why they don't have easier words. It just makes you feel like you need to be on medication just to read a medical terminology word. I mean, just my opinion, but anyway. So your doctor may prescribe you, I'm going to butcher this name too, I don't know, NUP, we're just going to spell it, people, NUPLAZID as in David. This medication treats hallucinations and delusions linked to psychosis that affect some people with Parkinson's disease. Sessions with a therapist can also help. Like if you have things going on with your behavior, or if you're struggling with stress or depression, obviously if you got bipolar or PTSD, there's a number of factors in there that have to do with your mental stability. It doesn't mean that you are, I don't mean to say this in all due respect, you're not a mental case. You just have some things going on mentally that need to be medically taken care of. And I think what I know I have been guilty for many, many years, and I'm just now recently taking care of my mental end of me too. Um, People forget that mental health is just, or if not as important as physical. And I know, like with depression, it eats at you. It really depression. I just did a podcast, my last podcast on depression. Um, but I know, like, if you have illnesses and stuff going on with you, depression starts attacking your weakest points. And at least this is what I've been told. And it attacks your weakest points. So, like, if you have like severe back problems, for instance, and you get in severe depression, and depression can be very crippling. I mean, it can be very big and very deadly. But if you're in severe depression or anything like that, it starts basically start jabbing, if you will, at the weakest points of you. So if you have physical attributes about you that are weaker than others, it might start to hinder those physical conditions a little bit more quicker, if you will, than ones that are a little bit more healthier. So obviously you want to make sure that you stay on top of your game on your physical health, but also your mental health. And you might find that your mental health will help to balance out your physical health. Because I know, like, with stress, anxiety, panic attacks, all that stuff right there, it has a big, huge havoc on your physical abilities as well, and your physical health. So you just definitely want to make sure that you take care of yourself. Dealing with drug hallucinations. If you're dealing with hallucinations relating to psychedelic or other drug use, you could have what's called a bad trip. You may feel like you're losing yourself or losing your mind. I do that on a day-to-day basis. I always say, where did my mind go? You may see things that scare you or lose your sense of self. Some people say you can avoid this by setting certain rules for yourself. Like sometimes people may are able to turn these experiences into something they learn from or they are challenged by. And I know, like, sometimes, people talk about how, they hear voices or different things that they're dealing with, or they can't get these voices out of their head, and they're constantly chitter-chattering and stuff, and they say all this stuff, and sometimes they say things that hurt you or make you question things, or maybe some of the things that are your insecurities or things that you worry about the most. That is where the weakest points are on you, I guess, per se. So maybe those particular types of hallucinations dig deeper in those areas of you. But I have been trying, I'm one of those people, I always try to find the good in everything. And I've tried to look at it as not all voices have to be bad. Not all demons, per se, are bad. And why can't we look at it as a positive side? If they're talking in your head, maybe they're concerned about you. Maybe they're trying to discuss on how to help you. Maybe they're, maybe they're trying to express to each other on how to make you feel more positive about yourself, or how to make you redirect yourself in a positive manner. Maybe you've been so negative your whole life from either the way people have made you feel or the way you have maybe you've gone through things in your life, and so, maybe you've been abused or you've been neglected or whatever the case may be. So you've got a lot of this negative pain about you, if you will, that is kind of embedded in you. So whenever you think of something, the first thing you're probably going to do is think negative or something painful. So it's really kind of hard for you to think of something happy or something more positive because you're so used to the opposite. So how can you hallucinate about something that's positive and good if you're used to all the positive and bad? So then I have found that I have been trying to counteract my negative with something good. And I have been very open and candid about me on certain things, but I am trying to teach myself to respect myself, to compliment myself, to redirect myself, try to be positive, try to counteract my pain and my heartache and all the negative things that people have reflected on me, to where when I look in the mirror, like I've said before, you look in the mirror, who do you see? Do you see yourself or the reflection of the way everybody in society has made you feel? And so if you have insecurities, I say like maybe your baby mama's giving you some drama and makes you feel like you're not a good dad, or has abused you in some way, or talked down to you, belittled you. So maybe then your one of your soft spots and one of your insecurities is in that area. So trying to work through a lot of insecurities is very difficult to do when you have nothing else in your life to redirect you to something more positive, if that makes sense. And, or maybe like you're so used to, putting yourself down, or think that you're not worth something, or you'll never amount to this, you don't deserve that, or whatever the case may be. Or maybe you have somebody in your life that you really, really love, but you have been in so many relationships that maybe you've been abused in them, maybe you have been belittled, maybe your self-esteem is about a millimeter big, and just made you feel inadequate. Or maybe your significant other or whoever has done things to you or messed around, or whatever the case may be. So if you're in another relationship and say it just seems too good to be true, or you really love this person or whatever, then maybe you get this emotion about you that it's making you kind of question everything, or sometimes, and I'm not saying that's always true, but I know like sometimes they say some people purposely try to find faults in relationships, to purposely try to, push people away, pull them back in, break up with them, or find ways to, do something like that. Find problems, and make problems, or invent problems, or deal with problems. And I'm not saying that's always the case, but some people are afraid of getting too close sometimes, that sometimes they find ways to sabotage the relationship, whether intentionally or not intentionally. And sometimes that could be a result of past thoughts or whatever, or they might get an insecurity. And that could just be something they're going with and they don't know how to handle it. So there's a lot of different factors there. But anytime somebody's going through things, like I said before, just because you're not experiencing it, or you can't relate to it, or you're not that person, or you've never seen whatever it is that they're talking about or dealing with, doesn't mean that it's not real. Maybe for one, maybe you missed it. Maybe you weren't there. Maybe you need to get your eyes checked and you couldn't see because you don't have your glasses on. Maybe you're having problems with your hearing and you don't realize it. Maybe you've got a cold and your sinuses and your breathing, or your sense of smell is not, totally up to par. It could be a number of factors. Or maybe it's something they're going through, and just because you don't see or hear it or deal, can relate to it, like I said, does not mean that it's not real to them. Just like if you were to go through something and say the tables were turned, you would want somebody to be a little bit more empathetic to you than judgmental to you and make you feel like a piece of poo. Because you're already dealing with something already. You don't know how to sort your feelings out. You don't know what you're supposed to be feeling. You feel like a crazy freak or whatever, and that's not fair. Because it could be something that either medication can take care of, medication needs to be adjusted, or, you might be having an adverse reaction to something. So it could be a number of things, or like I said, you could have an underlying condition you don't know. So there could be a lot of things in there. So if somebody doesn't witness this with you, doesn't mean that you shouldn't go talk to a doctor. And that doesn't mean you're crazy. That means you're going through something. And you're not crazy for that. You're going through something. And even though maybe some people cannot see or hear or relate to it, you can. And that's what makes it important. because you need to keep yourself in check on your mental stability, your physical stability. But nobody deserves to feel like they should seclude themselves, or I don't know. I mean, nobody should ever have to feel like their emotions, their feelings, and things that they're going through, they shouldn't feel belittled because somebody doesn't understand what is going on with them. And I always say, if people were less judgmental and more understanding, this world would be a greater place. Because so many people are so quick to pass judgment on people and make accusations and diagnoses and have opinions on things that they don't even have to deal with the repercussions on. So it's easy to have an opinion on somebody when you don't have to deal with the consequences. You don't have to deal with it in your life. You can voice your opinion and go on. It doesn't affect you. It doesn't affect anything you do. And it's easier to voice your opinion than to have to live through it, in my opinion. So if somebody is going through something, and they might not even want to talk about it because they might feel like they're crazy or they're a freak or nobody's going to believe them, or maybe they're questioning their own self, and trying to deal and don't know how to sort it out. But of course, obviously, if they do confide in you, also note that is a big step for that person to do. And if you react in anything but an empathetic way, you just did something more to that person who actually entrusted you to even come to you at all. Because that in itself is a huge step for them. So just kind of, in my opinion, just be knowledgeable, but also too, just people need to be there for people. I mean, even if you don't understand people, there's people that walk down the road and, maybe they look like they're strung out or they're spazzed out or, they must be on something. Maybe they are. Maybe they're having a bad reaction to their medication. Maybe they have an underlying condition they're trying to deal with. Maybe something has, set them off, or maybe they are on something. But instead of judging them and passing it off, they must be on something or whatever, be a little bit more empathetic of the root of why they're in the condition they are. Because there's always a root of an issue to everything. People don't just get up and say, ooh, I think I'm going to be delusional and hallucinate today. Or I'm going to, hey, I want to be an alcoholic or a drug addict, or, I'm going to be a kleptomaniac, or I think today I'm just going to have whatever. And it's very insensitive for society to be that way to each other. And it's actually, in all honesty, as a human being, it's degrading and ridiculous to be somebody that is a part of the world that other people make feel that they are less than deserving to be a part of that. And how dare they come to that factor or make that person feel that way? So it's just, and in all honesty, it might just be you one day in a reverse role. Because say maybe that person gets medication or gets their medicine adjusted, or maybe they get clean and they get off their drugs and alcohol or whatever. And then lo and behold, here you come, and maybe you're having a reaction. Maybe you're in a car wreck, and you're on some medication and stuff, and you got a little bit of swelling on your brain or something, or maybe something's happened and now you're having issues. And I don't think that you would want somebody to make you feel any less than, like a piece of crap or a mental case, or be insensitive to your, your situation. So, they would say, be nice to others and do unto others as you want done to you. But sometimes it's just a matter of, just don't be a butthead, and this, I think that's what's wrong with this world. People are so inclined to want so much drama and so much, did you hear so-and-so gossip and drama and just, negativity and all that. So it's like, feeding it. Everybody just wants that so much. And it's like, why can't we take that and turn around and make it better things, happy things, positive things. We got enough things in our life that has plenty of time to hurt us. Why do we need to amplify that? Why do we need to amplify pain? Because life is already a pain in the butt already. Why do we need to amplify it and make it more than what it deserves to be? And as a whole, as human beings, society, we're all supposed to be all in this together. But if we end up, keep treating each other like that, it's just not. That's just not a world that we deserve to live in like that, in my opinion. And nobody is better than anybody else. Nobody deserves to be labeled. Nobody deserves to be defined by their mental attributes, their physical attributes, their hair color, their eye color, their skin color, their nationality, their religion, the level of job they have, what kind of house they have or vehicle. Nobody deserves to be categorized unless it's one category, a human being. Because that is what's wrong with this world. We are too busy putting labels on people that we're not even seeing each other the way we deserve to see each other. Equal. We all bleed the same color. We all have the same thing in common. We are all going to die. We are human beings upon this earth that is rotating in a circle, or some people think it is flat and it's not moving at all. Whatever your belief is. But what the reality is, we're all here. You can believe whatever you want to believe on how you're here, why you're here, what's going on while you're here. But the fact of it all is we are here. And taking the time out to be compassionate and empathize to each other can also help you as a human being, as an individual, learn how to also do the same to yourself. Because if you're anything like me, negativity has basically defined your pain of your life in one way or another. Something negative, something painful, something devastating, something hurtful, however you want to word it, has affected you in your life. The way you are, the way you react to people, the way you react with yourself, your self-esteem. It all goes with it. And a lot of that stems back to your mental stability. And if somebody, with all due respect, gets in your head per se, and basically embeds things in your mind that are not so positive, eventually that is a sense of your identity and what you're going to believe, because that is something that you have been repeatedly pounded in your head. And so then eventually, if you're told this so much, then that must be true, right? And that's not fair. You have more right and more deserving to hear something positive about you than anything else. If you see somebody, out and about, like, for instance, I went to this restaurant and I saw this lady sit there and she had this real pretty dress on. And she was, I always say I'm a big girl, but I don't know. I used to be bigger than what I am. But anyway, she was a big girl too. But she looked really beautiful in her dress. And I'm not trying to say that to classify. I'm just trying to say people do classify people like that. And that's wrong. But I also know being in that similar kind of weight classification, if you will, the effects it has on you on your self-esteem. And it's always nice and complimentary when something like that happens to you, especially from a random person. And I went up to her and I was like, I really love your dress. It looks really pretty on you. And she just lit up from ear to ear. And she's like, thank you so much. And I walked away with a big smile on my face because I knew it. I mean, obviously it was true. But I also knew at that moment that did something for her. Because all I could have known was to me, she looked really pretty in her dress, but behind the scenes, she could have been feeling self-conscious. She could have been feeling like everybody's looking at her because, she's a big girl and she's in this dress. And maybe to her, it didn't look the most flattering looking in the mirror. And so she had this complex and this low self-esteem about herself. But then somebody she doesn't know comes up to her and says, that's a really pretty dress. Looks really nice on you. Then somebody noticed her and didn't even know her and made her feel beautiful. And it is something simple like that. It doesn't take but a second to be complimentary, or say something positive. You might be exactly what somebody else needs in their life on that day, in that moment. They might have been just so, maybe somebody they were with just belittled them and made fun of them, or, maybe it was, whatever, and they just felt, less than beautiful or less than handsome, or, maybe they didn't have the perfect body and they couldn't compete with, a model or this, that, and the other. So maybe their self-esteem was like a peanut. And it does take sometimes reinforcement from people that you don't know more than people than you do know. Because sometimes when people say, I'm not saying people that you do know shouldn't do the same thing, because I'm sure they're pretty quick to do the negative. Not all, but in my life, most of them. But if somebody they don't know comes up to them and is complimentary or does something nice for them or whatever the case may be, something positive, I think it makes a more direct impact on the reflection of how they respond to themselves, especially at that minute or in that moment. And, it could be something so simple, but it's just a matter of feeling special, and even if it's just one moment of feeling special, that's one moment less than feeling like a piece of crap, or belittling yourself, or talking down to yourself in the mirror, or making yourself feel like you're just worthless and nobody will want you, and you're broken and you're this, that, and the other, or you're getting old and you got wrinkles and gray hair, or maybe you got false teeth, or you're on medical machines, or whatever the case may be. And sometimes seeing yourself through outside eyes is sometimes close to impossible. And if you're anything like me, I have a hard time taking compliments because I'm so used to being put down in my life and made fun of and abused and all that stuff. Compliments are very I don't know how to respond to them. If somebody give me a compliment or something, hey, you look really nice, I'm like, oh yeah, so have you seen the gas prices today? I wouldn't. Sometimes don't even know how to react, or you feel very awkward. And stuff. And I'm trying to work on that. But it's very difficult when your self-esteem is so low to build that back up. And it does something to your mental well-being. It really does. And just being aware of that, because it does affect everybody. Living with hallucinations. When you have hallucinations, it's important to see a doctor for help. But you can also use strategies to help cope with seeing and hearing things that aren't there. Try different things to see what works. Understand your hallucinations. Learning more about them may help you feel more in control. You can start to know when they're causing you problems. Maybe change the way you think about them, or you feel in control. So like maybe you can notice what you're doing to trigger that moment of hallucinations, or whatever the case may be. Pay attention to what gets you, or what your mindset is, or what's going on, or did you just take your medicine, or different factors like that. Did you just get off the phone with somebody and maybe it triggered your PTSD, or whatever the case may be. Try to know yourself, and sometimes just redirecting yourself and trying to think of your hallucinations and your voices in a more positive direction, and it might actually flip your negativity of them in the direction of more positive and uplifting and reassuring, and try to find humor. And I say this with respect, but if you see something and it's something, maybe try to look at it differently. Instead of getting freaked out by it and scared by it, maybe try to look at it differently. Like, I know some people are scared of clowns. Me, I'm not. I used to have a clown collection. But look at it differently. Maybe it's supposed to make you smile and laugh and, or comical or something. Maybe you've been so sad and depressed and upset that maybe it's trying to make you happy and laugh and smile and do something opposite of your pain, or, something of that nature. Kind of like a silent movie, if you will, a little skit or whatever. Just different things, that might help you offset the things that scare you or send you in a negative direction. So trying to find, I try to find, like, every negative, I try to counteract with a positive. And sometimes it's impossible because I got so many negative things that it's hard to find the positive, especially when you've put yourself on the spot. But you got to constantly keep trying to reinforce the positives in you, so that way you not only hear yourself giving you positive reinforcement, but you want to be able to hear it enough that you finally end up believing it and actually feeling it. Because hearing your positive reinforcement and believing it and feeling it are all different things. And you have been feeling all the pain and negativity from probably most or if not all of your life, that it's really hard to imagine yourself feeling anything different. And I know, like me, it's like happy. I don't even know what it feels like to be happy anymore. It's not a feeling that is common with me anymore. But I'm trying to teach myself there is happy in it, and find something happy. Make, happy. And, I had this friend, and I would, say to him, all the stuff that was going on in my life, it was just very devastating and trauma and tragedy and stuff. And I would say to him, tell me something happy. Please tell me something happy. Because in all the pain and heartache I was feeling in my life, if he could tell me something happy, then it made me feel like I had a chance at something that was still good to hold on to. There was still something good out of all the pain I was feeling. And it just, it made a big, huge impact on me, because I needed that. Or whenever, I was feeling, pretty much at a very hard time in my life. And sometimes I really needed those reinforcements from him, pretty much more than anything else at the moment, So trying to make sure that you can create your own happy, but also to be the reason to try to help other people feel happy, and I always say laughing is contagious. You could sit in a room and just start laughing, not even have nothing to laugh at, just start laughing. Other people in that room will start laughing, and they have no freaking idea what they're laughing over, and you're not even laughing over anything. Y'all are just laughing. And that is what is good about it, because that's the way it should be. You should be able to laugh at life and fun things instead of standing in the mirror and laughing and making fun of yourself or other people. Because that's not mental wellness. That's just not nice. It's very inhumane to be that way to people. It really is. And it takes a toll on people. It takes a huge toll on people. Track your hallucinations. Try keeping a diary or jotting them down to look for patterns and notice your triggers. Talk to them. Work to build a positive relationship with your hallucinations. Try different approaches to talking and responding to them. For example, try challenging them, being kind to them, responding to them, being neutral, or maybe I read somewhere where it said set a time frame that we can only have interaction between this time, and other than that, no, it's my time. Now, whether or not that works for people, I don't know. But I talk to myself all the time, and I do. And I'll be out at the store, I'll be in my car, I'll be walking around the house, out in the yard, whatever it is. I mean, I ain't no shame in it. I talk to myself. I have conversations with myself. I laugh at myself. I tell jokes to myself. I have little skits and little, I don't know. I do like voice impressions and stuff. I entertain myself. And I'm not ashamed of that. I should not, and I've said this before, I am trying to teach myself that I do not deserve to be ashamed of myself. There is no reason why I should feel ashamed of being me. Who gives anybody the right to make me feel that I should be ashamed of me? Because if I cannot be me with me, then why can't, what am I, what good am I to be able to be with anybody else or expect anybody else to be good with me or, interact with me? I have to be, first and foremost, in tune with myself, if you will, before I can let anything else have influence on me. Because everything has influenced me so much already in my life that's why I'm in the position I am mentally. I have more trauma and drama and recovery, responses, if you will, of survival, that it's become a way of overtaking my mental stability. And I feel like enough is enough. Society has already done so much damage in my life that I have so many years of my life to try to redirect in a positive manner that I'll probably die before it happens all. Because there's just so much in my life. And I'm already 51 and a half years old. And I hate to put the half on there. 51 years old. Or 49 plus 2. However you want to look at it. But there's no way that I can undo 51 years of my life. Especially overnight. You cannot undo all the damage played havoc in your mind and your mental stability so quickly. Hell, it's going to take more than a freaking year, because there's so much that you have to not only work through and heal from, but you also need to be honest with yourself on things. You need to know how to redirect yourself. You need to learn how to calm yourself down when you have triggers. You need to learn to trust yourself, believe in yourself, and eventually, hopefully, get to the point where you can actually learn to even like or love yourself. And first and foremost, you need to remember that you are a human being. You are not perfect. And anybody says they're perfect is lying. There's nothing perfect. And you are worth more than everybody else has ever made you feel that has been painful. And if you're crazy, I'm going to tell you this. Crazy is the new normal. Everybody's got something going on. And there's always something. Somebody's going through something pretty much all the time. And if you're not, I'd like to know what your secret is. And if you say you're not, 9 times out of 10, you're either in denial or you're lying. And I'm not trying to be mean, but everybody's got something going on. Could be drama at work, at home, death, excuse me, family, your own, self-worth, your own searching, maybe even a midlife crisis. Whatever the case may be, somebody's always got something going on. And sometimes you need to challenge yourself to see yourself in a better way. And actually remember that the reflection you see in the mirror is you. And then to the point you'll get to, hopefully, you don't even need a mirror to see yourself, to feel beautiful. And it's not always feeling beautiful and looking beautiful are not always the same. Because you could have the highest bougie, expensive attire on, drive the fanciest car, whatever the case may be. And your self-esteem might be so low that you feel as like an ogre. And eventually that's all you know. And all the other stuff eventually just becomes, just common background for you, if so to speak. Distract yourself. If you want to ignore your hallucinations, try to find ways to block them out. Focus on things in your environment that you can sense. Concentrate on your breathing. Do something else, such as exercise, cook, or listen to music. I know, like with my mom, when her Charles bonnet would kick in, I would tell her to distract herself and try to find something different to do to get her mind redirected off of whatever hallucination she was going through. And she tried to learn how to do that. And she still has some issues and situations sometimes. It wasn't too long ago, she actually swore that there was a little black cat in the house. And mind you, my mom's blind. So, how in the world she would have saw a little black cat, I don't know, but also too, we don't even have a cat. And, she really was like, I saw a little cat here. I saw its shadow, and it was trying to get up in my bed and stuff. And I said, I don't know. I didn't see one. Maybe it got out, or whatever, or maybe your Charles bonnet is kicked in. And she's like, maybe, and so it's just time. I wasn't trying to make it awkward for her, nor was I trying to make her feel like I thought she was crazy, or I didn't believe her, or, she's lost her mind, or, she didn't see actually what she believed she saw, so instead I just was like, she knows she's got that, and other things, also in her medication and stuff. And sometimes when your oxygen is low, sometimes you get delusional as well, because you don't have enough oxygen going to your brain. So sometimes your comprehension of things and your perception of things are not totally up to par either. So just talking to her and giving the suggestion is maybe, your Charles bonnet's kicked in, or, I don't know, Mom, I didn't see it. Maybe it got out, when we opened the door, or, maybe it's a stray and we just didn't see it come in, or something like that. But when I mentioned her Charles bonnet, she said, yeah, maybe, that might be it. So trying to find ways to distract yourself, to redirect your brain, so to speak, can also help. So that's a positive thing that maybe you can learn, to find something positive to redirect your mind, your thoughts, your feelings, and try to put them in a positive place. And somewhere to put them, because obviously if you have doubts or made to feel less than of a person, or a crazy person per se, with all due respect, and that in itself can also cause problems for you, or maybe intensify things that you're already going through. So that's something else you might consider. Join a support group. There's people obviously dealing and going through the same things that you may be doing, so trying to find somebody that can relate, or maybe have a better understanding of some things that you're going through, or maybe they might have some different coping mechanisms or some suggestions or something that might help you. But talking about it, obviously you might have some underlining childhood things that you've went through, or some stress, or some type of mental pain, if you will, that you've had to deal with, and depression or grief or trauma, tragedy, or something of that nature that maybe has been overlapping your life, and maybe something like that, and getting some help or talking to somebody might help. So that's something else to consider. Find faith in community. If you think you might if it might help, reach out to people in your faith community or find a new place to worship. So, like, maybe you can go like to church and stuff, and finding, ways there and positive reinforcement. But, pray. I do that quite often. And somebody asked me one time, what do you do when your soul is shattered? And I looked at them and I said, I pray. And sometimes it is that deep with yourself when you feel like your whole mental well-being and the stability of who you are and the direction of everything about you is shattered and in pieces that you don't even know. You don't even know how to collect them and where to start gluing them back together. Or if you even can. And, I used to always say, sometimes you got to fall completely apart to know where you need to be put back together. And that's kind of where I'm at right now in my life. But I'm also trying to decide and figure out which pieces that have fallen apart have a place in my rebuilding of myself. Because some things can just stay where they are. I don't need them back in my rebuilding. And there's other things that were perfect or good or maybe not so bad that maybe I could try to find a different way to interact or adjust or whatever. That maybe not necessarily a painful or harmful thing, but maybe just needs to be redirected in a different way, in a different frame of mind. But some things are so painful and hurtful and traumatizing, like, for example, belittling myself or putting myself down. I'm trying to teach myself to leave those out of my rebuilding because I don't need to embed that kind of pain back on me when it's already been deep enough that it's part of the reason why I'm shattered. So why would I want to glue that back to me and basically engrave it in myself when I'm trying to heal from it? And I know that probably sounds easier said than done, but I know it is, but it's something really to consider and think about, because the only way you're going to be able to redirect in a positive manner is to find what works for you to redirect yourself in a positive manner. Because I can give you all the, points of examples and resources and, suggestions and whatever, but that doesn't mean it's going to work for you. And sometimes it's a matter of trial and error. Or you might think that you need to take something with you in your rebuilding, all to find out that maybe you need to not take it with you and you need to put it back down. Or maybe you don't need as much of it as you thought. So it's a lot of learning, a lot of trial and error, but a lot of trusting yourself with yourself and being honest with what you really deserve. And you deserve to be respectful to yourself, be nice to yourself, appreciate yourself, compliment yourself, all the positive reinforcement things. Even if you have to make a list of different positive reinforcements that you could use to counteract when you have a bad reaction. Like, I know sometimes I'll be like, I'm just so stupid. I'm stupid. And then I'll be like, no, you're not stupid. You just need to think of this differently. Maybe you just need to, rethink it and maybe try to look at it from a different angle. Or, or just I'll say like, I'm ugly, or I hate the way I look, or I'm fat, or nobody's going to want me. I'm damaged goods. I'm just so messed up. Nobody's going to want me because I'm just going to be high maintenance. I'm going to be a lot, to deal with and whatever. But then I have to stop myself. And I say, no, I'm a human being. I'm a beautiful person. I'm smart. I'm funny. Sometimes I'm funny looking. Um, I'm resourceful. I'm giving. I'm kind. I'm gentle. I'm understanding. I'm caring. I'm forgiving. Um, I'm me. I'm worthy. And I try to learn how to take that and turn it around to something positive. And why shouldn't I? Why shouldn't I feel beautiful as a person, even if I don't necessarily look beautiful in the eyes of other people? Because not everybody has, some people need glasses, and they don't even have bad eyes. Sometimes they just see what they want to see what they feel, see what based off of what other people have based it off of. And sometimes just simply because that's just who they are. And they're so quick to, I guess, make a judgment or an opinion or whatever the case may be without even knowing, not even knowing the person at all. And that's a big part, I think, of a lot of our problem in the world. Because everybody's so quick to say that they know people or they know how things are, when in fact they really don't know that person at all. Probably just know their first name or what somebody's told them, And it's so easy to pass judgment on somebody based off other people's opinions. But we shouldn't do that, and just because somebody else don't like so-and-so doesn't mean you can't like them. Maybe they're just not compatible with the other person. We all have different personalities. Or maybe, they have bad, stuff between them because maybe somebody used to date somebody something, What does that got to do with you? So just a thought. Mental stability goes a lot farther than just trying to... mental stability goes a lot farther than classifying people as a mental case. Because that's what's wrong with our group, our society, of our human beings, of our interactions with people. That's like labeling people with disabilities. We are so quick to judge them or think that they are not capable of doing things or thinking for themselves or acting certain ways or whatever. And why? Because they have a disability that you don't understand, or and maybe it's not even a disability. Maybe it's it's like my granddaughter has Down syndrome, and it's not a disability. If we had more people in the world like her, this world would be a beautiful place, straight up. And I always say our children are innocent until we corrupt them. And heaven help our children, because we got a lot of repair to do, not only to ourselves, but our children and our generations behind us, because we are the reflection of what they are going to end up seeing in their mirror. And that can be a huge mental consequence. And we're not even going to be here to be able to help them through it, because our generations are going to be gone. And we're going to leave our children behind to clean up our mental mess. And that's not fair. That's straight up not fair. Take care of yourself. Do your best to get enough sleep. Eat well, relax, spend time outside, exercise. I know, like, the sun is very good vitamin D. And it's very good to raise your endorphins and, your dopamine and stuff like that. Happy stuff, your happy hormones. And I was really bad at not going And like I said before, sometimes I'd go a whole week and I didn't open my front door. So I try to get it now to where I at least look outside or go outside at least once a day. And if the sun is shining, take it in. Just take it in and enjoy the beautiful, bright sunshine, the sky, listen to the birds and, the trees blowing and, whatever. And people laughing, playing, cars going by. It's life. And just because you don't feel like you're a part of it, doesn't mean it's not still going on without you. Because it's still going on. And sometimes, I used to always say, sometimes in my life, I feel like my life is just passing me by, and I'm trying to jump up there high enough to catch on just to be a part of it. Because I feel so left out of my own life. And that's a very deep thing to feel. And sometimes I say living just sucks the life right out of me. Because sometimes it does get that deep. And trying to find a way to resuscitate yourself, theoretically speaking, is something I'm still trying to teach myself to do. And sometimes I just can't. And so then I have to find a backup plan, or I just cover my head up and wait until I, hopefully calm down, because I get my panic attacks sometimes, and I might be driving down the road and all of a sudden my panic attack kicks in and I'm like bawling my eyes out, can't hardly see to drive and freaking the heck out, and it's like, where in the hell did this come from? Or my anxiety builds up, or my PTSD kicks in, or just whatever it is, or my mood switch will kick in, or something is always going on. And learning how to know myself, learn myself, teach myself, and recognize myself sometimes can be, it can sometimes feel impossible. But then also sometimes it feels like you're even crazier to think that you can even do that, or that's even possible, or it sounds crazy. I keep throwing that word around in here, but it just seems very crazy and impossible, and or out of your reach, or maybe you're in denial thinking that you don't need to, you're fine, when in fact maybe at that moment you're having a good moment. Maybe something is going on at that moment and you're okay. But then if you're like me, usually when you're laughing and cutting up and whatever, and having a good old time, then all of a sudden there's a big huge switch, and then you're big time down, quiet, and depressed and withdrawn. And I am notorious for that, and I'm trying to recognize that, and trying to figure out why I do that and how to intervene it, because I don't like feeling that way. And if anybody knows me, they know I like to laugh, cut up, make jokes, and I love making other people laugh. And it's very difficult when I go to do that, but sometimes it's difficult when I don't do that, because in some incidences, it might get on somebody's nerves and they tell me to stop, or whatever the case may be. And then you end up going to the point where you're like, oh, I forgot, I can't have fun over here, or I'm not in the fun room, or, they don't like my jokes, or I need to stop doing that because it gets on their nerves. And then eventually you're quiet. And the one certain way that you find comfort in, if per se, is the one attribute of yourself that you need to make dormant, because wherever you're at, it's just they don't want you to be you at that moment. And it's hard not to be you, especially when you're trying to be you and try to figure out even what you are, if that makes sense. In my head, it makes sense, but that's scary. But anyway, it says consider a service dog. Psychiatric service dogs can help with a variety of tasks. When you have a mental health condition, including hallucinations, a dog can help you to tell whether what you are seeing is real or not. For example, they greet people who walk into the room to help you know they're real. So, obviously, a service dog is nice. And I know a lot of people that I've come across have companions, animal companions that are their support, system, their anxiety companion, their panic companion, their comfort. And it don't necessarily have to be an animal. I mean, it could be anything. Like, I've talked about it several times. Ain't no shame in my game. I sleep with a teddy bear. I've had him. He looks pretty flat like a pancake. He's had it pretty rough. His overalls are ripped, and I need to hem him up to have him where they don't rip off his body. I mean, some people would say that, you need to get a new pair, but this bear has a lot of sentimental to me. And the outfit actually came from somebody that, very special to me, and I don't want to take it off and be rid of it just because it's torn. Instead, I can hopefully hem it or sew it back together, or maybe give my teddy bear a nice belt or something to hold its bib overalls on. So finding comfort in something, and he has been my support. He's my comfort bear. And like I said, there's no shame in it. You got to do what you need to do to be able to survive even your own mind. Because a lot of times that is the deadliest place to be. So if you can't be a soldier of your own mind to go to combat, if you will, or battle for yourself, and defend yourself with yourself, and protect yourself with yourself, then, really, it's a really hard place to be. Especially when you feel defeated, and you don't know, you don't even know what your next thought could even possibly be, because maybe everywhere you look and everything you feel just hurts. And it's hard to find something positive and happy when everywhere you look hurts, and everything you think about hurts, and everything you want to do hurts. So what do you do? And that's what I'm trying to work through and learn. That's kind of where I'm at now. But so how do you help somebody with hallucinations? If someone you care about is having hallucinations, here are some things that you may do to help. Work to understand their hallucinations, and if they are causing them to be upset or hazardous. Because sometimes some hallucinations could be hazardous. Maybe they're seeing something that isn't there, and maybe it causes them to fall, or take out a weapon, or lunge at somebody, or maybe they're driving and they're in a wreck, or whatever the case may be. Maybe they fall off of a balcony or a bridge or something, because they see something that's not there. And so just try to kind of pay attention to things and be aware of their surroundings, but also to your surroundings and safety. Offer reassurance and comforting touch if appropriate. Obviously, if they're hallucinating, my opinion, you might want to ask them if it's okay. Ask them, is it okay if I give you a hug? Is it okay if I put my head on your shoulder? Is it okay if I hold your hand? Ask them if it's okay. Because they might be going through something or dealing with something, and they can't balance that type of contact at that time, if you will. So, and also too, the element of surprise is not always good, especially if somebody is hallucinating or having a moment, and making sure that you are considerate and compassionate about that. And basically, however if you can relate to that, obviously that's something to think about, but be considerate of their surroundings, more so probably on that area than your own, because their surroundings obviously are not going to look like yours if they're hallucinating. Avoid arguing about whether or not the hallucinations are real. Like I said, just because you don't see them and they're not real to you doesn't mean they're not real, because they're real to them. Don't intervene unless you need to for their own protection. Like I said, don't just randomly approach them or, just make sure you're knowledgeable, but be considerate, and don't, just startle them or be aggressive or, verbally stern, if you will. Your vocalization and stuff, the way you approach them, sometimes could have an adverse reaction to them, to where if they're going through something, they might then see you a little differently than, say, they would in a different manner, because if they're triggered in a certain type of a way, then you're going to be included in that hallucination per se, and their reaction to you is going to be different than what might normally be normal. So just try to make sure that I say it's a lot to pay attention to and to understand. And you know what? In all fairness, it is. But if you take that in consideration and then you put it in the perspective of the person that's going through it, and then add what you're dealing with on top of it, you might have just a smidge of an isolation of where that person may be hovering at with themselves and the world. And if you take that and I guess not necessarily put bubble wrap around them, but sometimes you have to be their safety. You have to be their safe place sometimes. And if they are feeling some type of way, they need to know a home base, something that grounds them, something that gives them a foundation of stability, something that brings them back to feeling less scared maybe, or afraid of something, or it might detour them on redirecting and getting their mind to shift and be more positive. And, try to, if you're going to intervene, just know what you're intervening. You're intervening a human being. You're not intervening a freak. You're not intervening a loco-moco wacko. You're intervening a human being person that is going through something. Whether you understand it, can see it, acknowledge it, or whatever, they are going through it. And if you are going to be a part of their intervention or their moment or their hallucination or whatever the case may be, do it in a manner that is not intentionally or unintentionally attacking or degrading or demanding or making them feel that their feelings are not justified, that they aren't any less than trying to figure out what it is they're trying to figure out. And all due respect, they might be seeing something a lot more cooler than what you're seeing. They might actually be seeing something neat and funny and whatever. It might be an actually really good hallucination. Maybe, maybe your friend is a female and she's hallucinating some, cabana boy. Would that be so bad? But if you go and interrupt her, she's not going to be happy. But then again, if she's hallucinating, parasailing or something, and she's not, that might be a different subject. You might want to go find a lifeguard or go find that cabana boy or intervene her in a positive direction that doesn't startle her, because sometimes that can be unhealthy as well. It's kind of like somebody who's kind of sleepwalking but not. They say don't wake them up. I mean, that's kind of the same but not. It's all kind of how you react. And sometimes the best reaction is not necessarily reacting. It's just giving a sense of reassurance that they're there, that you're there, and you're a safe place for them. And that is very, very vital, I have learned. Because everybody needs to have a safe place to be able to basically, feel like they can get a breath of air. Because sometimes they get so overwhelmed in whatever they're going through that their own breath is suffocating them, and they don't even know what to do about it. It's so overwhelming. And so many people have probably made them feel less than, made them feel less than a person, or less than somebody that's going through something. And maybe they've been going through something for so long that they've started to self-medicate. And sometimes people self-medicate because they're trying to overcome something or deal with something. And if that self-medication is not working, then they might go into another one and another one. And before you know it, they get so many self-medications that it's actually doing more harm than good. Or maybe they stay self-medicated because that world is a lot more understanding than the real one. So be knowledgeable on how you approach, how you react, but also too, just give a sense of comfort and reassuring. You don't even have to talk and, give all this advice and lecturing or whatever. Sometimes just knowing that you're present and, are you okay? Do you need anything? Can I do anything for you? Or I'm here if you need to talk. Or just say, hey man, what's up? What's going on? Change the subject or whatever. And just, whatever the case may be, redirect the moment without being redirective, if that makes any sense. Like, you're not really necessarily redirecting them, you're redirecting the moment and hoping that they become a part of the new moment instead of being caught up in the other moment that's hurting them. And sometimes that can make a difference as well. I have learned, anyway. Acknowledge what they're seeing in a calm manner. Obviously, that again, don't come at them and, be degrading or stern or hateful or judgmental. You want to come in there as a human being person and acknowledge that they're the same. They're a human being. They have feelings. They have emotions. And, so basically taken away. Hallucinations are false perceptions in which you'll think you're seeing, hearing, touching, or tasting something that isn't there. And many things can cause them. They may be temporary, ongoing. Your loved ones may be hallucinating. Obviously see a doctor. Stress can be a factor. Recovering from something. And anxiety. And if hallucinations get to be where they seem so real for somebody, they actually can become deadly. So, again, if you're going through something, please reach out to somebody and try to get some help and some intervention, and know that you're not a crazy, and you're not. You deserve to be happy. You deserve to have a reason to smile. And you deserve to be able to make faces at yourself in the mirror without feeling stupid. Because you've been looking at yourself in the mirror talking down to yourself, why can't you look at the mirror and make yourself laugh? Say something funny to yourself, but say it in a way that you're not making yourself feel stupid, if that makes sense. Because you're not stupid. You're a human being and you matter. You totally 100% matter. And we should not categorize each other, because that's what our problem is. And if you are going through something, 988 is a suicide prevention hotline. Reach out to your doctor, your pharmacist, people that you trust and know. But also to just know that I say this with all due respect. I know it's easier said than to believe. But just know that you're not alone. And I maybe that sounds a little far-fetched when you talk about hallucinations and voices. But not all your voices and demons need to be a reflection of all the pain and trauma that you've been made to feel. Because in your life, you've also had some good things too. You've had moments of laughter and good times and good memories and good moments. So try to redirect that and try to turn it around for yourself. Because life gives you enough heartache. Our minds don't need to amplify it. So on that note, I'm going to close up now. And as always, if you've given your time up to listen to me, I wholeheartedly appreciate it, because your time is something that you never get back. And if you've shared it with me, then from the bottom of my heart, I totally appreciate it. So on that note, everybody take care. Remember, your mental health and stability is just as vital as your physical. And I pray that you don't feel any less than the beautiful person that you are. And on that, I'm going to close out. So until next time, I'm going to let you go, and I hope everybody has a safe, blessed, and crazy day. Bye.